lot of restaurants that survived the COVID-19 pandemic, the Ardmore Tea Room has changed, but its classic charm remains.
But how hard was it, though, in those early days?
It was bad. It was bad. Like, you know, feeling was there was really, like, the first time we got shut down, it was, you know, okay, we'll be, but then the second time and the third time, it became, you know, is the staff ever going to get to come back to work?
It was 5 years ago today, the World Health Organization declared COVID-19 a pandemic. At the time, the Ardmore Tea Room had to make some big changes to stay afloat.
Our takeout businesses, you know, we used to do very little, maybe an order or two a day. Now it's probably like 30% of the business.
Although the pandemic is now over, the coronavirus is still circulating.
I got a mask in my pocket, right? So it's always, and this wasn't planned, it's just here. I hope we learn.
This teacher says things in the classroom have changed.
We're like more hypervigilant on, like, you know, hand washing, sanitizing, all of those things, and like being more mindful of, like, you know, kids that might be sick or have symptoms of certain things that we might not have paid as much attention to before.
This infectious disease expert was a go-to source for information during the height of the pandemic. Dr. Lisa Barrett says we still have to be mindful of the virus and take lessons from what went right.
We've demonstrated that science can have a huge impact. Vaccines, new ways to test people fast, all kinds of ways of using technology to bring healthcare and, you know, everything to people during a pandemic.
The province's chief medical officer of health agrees and believes we're better prepared for future emergencies.
We've got better connections across the health system as a result of our work in COVID, so public health working with primary care and our hospitals in a much more effective manner.
Now, even beyond health emergencies, Dr. Strang believed our response to the pandemic helped prepare the province to better handle general emergencies like the wildfire he pointed to that happened 2 years ago. Now, it's important to remember that COVID-19 is still circulating. I spoke with a Department of Health and Wellness representative today that told me they will have a vaccination program for COVID-19 that's ready to go out in the spring. So we're still really living with the virus, Katie.
Good to know. Thank you so much, Jesse.
Thanks, Katie.
CTV's Jesse Thomas for us in our Halifax newsroom tonight.